The decades-long practice of housing elderly boarders at the Juan Louis Medical Center must come to an end when the facility makes the transition to new temporary accommodations on St. Croix. That's what JFL Chief Executive Officer Douglas Koch told lawmakers during testimony on Friday.
This problem has been going on for decades and is largely outside the control of the hospital. Yet the failure to address this problem adequately results in the burden falling directly on hospital operations. Our ability to effectively and efficiently conduct medical care to this community is compromised on a daily basis. Our beds, nurses, and other resources are being tied up by individuals that have no medical reason to be at the hospital. We have on average 8 to 10 boarders in the hospital every day. This takes up approximately 35 to 40% of the adult medical surgical beds. This causes a backlog in the patients that are being admitted to the hospital, now occupying rooms in the emergency room. This is why we have extremely long waits in the emergency room. On most days, we operate our emergency room with 4 or 5 rooms. We should have at least 12 available for services. We need to implement permanent solutions so that our community members in need of medical care are not unnecessarily delayed when they arrive in the emergency room.
The boarders, according to Koch, are, quote, very frail seniors who do not necessarily have a medical condition requiring hospital admission, but who do not have anywhere else to go. They can't live alone or take care of themselves and have no accommodation where their needs are able to be met. Caring for the boarders costs approximately $1,800 per bed per day.
That becomes a bed that is zero revenue for the hospital. There's no one the hospital can charge for the boarder patient. They are not a hospital patient, so there's no justification of a charge. If that bed was either occupied by Medicaid or Medicare or Cigna person, the revenue would be different, but at least it would be revenue. And then plus the knowing that they may have to delay surgery, knowing they may have to stay in the emergency room, it leads towards, I think, more incentive for people to seek medical care outside the territory, so it hurts in that respect as well.
That was Christopher Finch, chair of the Virgin Islands Government Hospitals and Health Facilities Corporation and member of the St. Croix District Governing Board for JFL, who says that the border problem is a direct reflection of the lack of adequate long-term care services in the territory.
First, the hospital is not the best placement. While they receive physical and health care, the hospital is not set up to provide the social and emotional and recreational services they would receive at an appropriate senior facility. A hospital bed is far more expensive than any nursing home. The hospitals cannot charge any of the third-party payers, not insurance or Medicare or Medicaid, for boarder care since they are not properly hospital patients. In other words, there are no medical reasons for the person to be hospitalized. The hospital loses the revenue that would otherwise be provided from that bed being used for its proper hospital patient purpose. For the public, the phenomena that our limited beds are thus occupied may mean a delay in scheduling surgery or spending days in the emergency room waiting for a bed opening. Additionally, this creates a morale challenge for staff.
Presently, both hospitals, JFL and Schneider Regional Medical Center, are working closely with the Department of Health, the Department of Human Services, and the Office of Management and Budget to find alternative placements for the 18 boarders currently at JFL and SRMC. Finch said that representatives from a long-term care facility in Puerto Rico came to the USVI last week to meet and assess the care needs of 6 potential boarders they have agreed to take in. The Department of Human Services is also planning for additional placements at the Herbert Grigg and Queen Louise homes for the aged and potentially other on and off island facilities. Senator Novell Francis visited the Herbert Grigg home for the aged, and the chair of the Committee on Health, Hospitals and Human Services agreed that there was an opportunity to retrofit that facility to accommodate the boarders, but also argued that families need to come forward and take responsibility for their loved ones.
Of course, we have to balance the 18 boarders with the waiting list. The commissioner is very concerned about that, but nonetheless, I believe that we could reduce significantly the amount of boarders that we're seeing at our healthcare facility at the hospitals in short order. So it's something that we will be working on in the near future. I just wanted to go ahead and put that on the record because it is problematic. That In addition to the possibility of placing some of those individuals off island, have been discussed. I would prefer for us to at least be able to at least get them housed here locally, because I think that to just relocate them, even though there's very limited or no visitation being done at the hospital, as soon as you move them off island, have family members and everybody else coming out to really address that. In addition to that, we're really going to take a look at how the individuals that's ultimately responsible for them, if in fact the state has become the ward of these individuals, then the funding and everything associated with their maintenance needs to also come to the facilities that will be taking care of them. So that's also, we're looking at legislation that will be able to address that. You can't continue to receive the Social Security benefit, disability benefits, and you utilize it for your own aggrandizement while your family members remain at the hospital and really being taken care of by the government of the Virgin Islands.
The existence of the borders was named as the #1 challenge in making the transition for JFL, but Coke highlighted staffing challenges as also being a major issue. Just like the rest of the country, Coke said his facility was dealing with the effects of an aging workforce, retirements, burnout, and the increasing cost of traveler or agency staff.